I'm Dr. Sathya. I'm a clinical director of the Department of Fertility in Cloud9 Hospital, Chennai. I'd like to talk to you today on the basic evaluation for fertility for both females and men. So, evaluation of female fertility is based on few things: age, duration of infertility, whether she has ever conceived before or not, and a few other tests. So, let me go step by step. The first important thing is we want to determine how old the woman is, because as age increases, fertility declines. The second is duration of fertility. The longer the duration of infertility, the lower is the chance of a natural pregnancy. The third point is whether she is primarily infertile, that is, whether she has conceived ever before. If she has conceived before, whatever be the outcome of that pregnancy, she stands a better chance of getting pregnant than someone who has never conceived before. The fourth is her own other hormone related and structural factors. So, the first thing we look at is whether she has regular menstrual cycles. A woman who has regular cycles is most likely to be releasing an egg. So, that is reassuring for us. The second thing that we need to check is whether her fallopian tubes are patent or whether they are blocked. And the easiest way to check the patency of fallopian tube is by a test called HSG, hysterosalpingogram. Here we inject a dye into the uterus from below and an X-ray picture is taken. And if there is no block in the fallopian tube, we would be able to clearly see the dye coming out of the fallopian tubes. And that again is a reassuring factor. The third point that needs to be checked is the cavity of the uterus where the baby is going to grow. And this is basically done by an ultrasound scan around the 10th to 12th day of the cycle. So, we essentially check the lining of the uterus, which we call as endometrium, and if it is anywhere between 8 and 12 millimeters, then we are happy with that lining thickness. We also look for other factors which would contribute to fertility problems, like polycystic ovaries on ultrasound, a swollen tube called hydrosalpinx, growths on the uterus called fibroids, and some changes in the uterine muscle called adenomyosis, and growths within the uterus like polyps or submucous fibroids. So, this basically completes the evaluation of a female partner. In cases where the woman has heavy pain during her periods or painful intercourse, we opt for a test called laparoscopy, wherein we put a telescope into the tummy to look at the uterus, the tubes, ovaries, all in real time to make sure everything is normal. There are times where we find adhesions or lesions called endometriosis, which contribute to infertility, and they have to be dealt with in the same sitting. Now, coming to the evaluation of the male factor, the first and the most basic test we do for a man is a semen analysis. For the semen analysis, we need the man to come to the hospital and provide us with a semen sample with a 2-day abstinence. We don't like a very long abstinence because it leads to presence of lots of dead sperms. Similarly, a very short abstinence period reduces the number of sperms. So, an optimal period is around 2 to 3 days. Usually, the mode of collection for the sample is by masturbation. A container is provided in the hospital and the man collects it in the hospital premises in a separate room provided for this purpose, and he hands over the container to the andrology lab, which reports within an hour or two at the most. The main features that we look for in the semen analysis are the volume, that is how many ml of semen did the man provide, and a minimum of 1.5 ml is considered as normal. The next point we look for is how many sperms were there in each ml that he provided, and that is called concentration. And the minimum number as suggested by the WHO is 15 million. So, if a man has 15 million per ml or more, that is considered to be minimally adequate. Similarly, the number of sperms that move are very, very important, because these are the sperms which will ultimately go and enter the egg. So, out of 100 sperms, at least 40 should have a moving capacity. And finally, out of 100 sperms, at least 4 should be structurally normal, because the normal sperms have a higher chance of creating a healthy baby. So these are the points that are looked for in a semen analysis. If any parameter is not normal, then we ask for a repeat semen analysis, and we use that second semen analysis as an opportunity to examine the man physically to make sure we are not missing out any physical cause for infertility.